Chapter 9 of ICD-10-CM is for diseases of the circulatory system. This presentation will cover the official ICD-10 guidelines specific to this chapter. There will also be clinical scenarios to practice coding what you just learned, followed by a small quiz at the end of the presentation. For each coding example, you will need to pause the webinar and use your ICD-10-CM coding manual to code the scenario. Once you resume the webinar, we will go over the correct codes, the rationale behind them, as well as how to locate them in the ICD-10 manual. Keep in mind that there may be more than one way to find a code. We are aware that there is a great deal of information contained in this presentation. Therefore, at any time during the webinar, please feel free to pause and replay as needed. It is important that you have already completed the Introduction to ICD-10-CM webinar, as you will use the conventions and general guidelines discussed in the introduction to complete the coding scenarios. As you can see on this slide, the codes for this chapter start with the letter I, which looks a lot like a number 1, so be very careful when you're typing out these codes. If you remember from ICD-9, the circulatory codes all started with the numbers 3 and 4. There are many more ICD-10 codes due to the addition of many combination codes, such as dysphagia following intracerebral hemorrhage. I was very excited to learn that ICD-10 actually condenses the number of codes for hypertension. Benign, malignant, and unspecified hypertension are all gone, replaced by code I-10 for essential primary hypertension, which includes the terms high blood pressure, arterial, benign, malignant, or systemic hypertension. There is also no hypertension table like there was in ICD-9. As in ICD-9, there are still codes for hypertensive chronic kidney disease, which is category I-12. You will need to use a code from this category as well as an additional code for the stage of the chronic kidney disease, which is category N18. ICD-10 assumes a relationship between the hypertension and the CKD. Therefore, as long as documentation states that the patient has both hypertension and chronic kidney disease, you would use the combo code from category I-12 for hypertensive chronic kidney disease. It is not necessary to also use a code for hypertension. For hypertensive heart disease, which is category I-11, or hypertensive heart and chronic kidney disease, which is category I-13, documentation must link the hypertension to the heart disease, such as hypertensive heart failure or hypertension causing heart disease, etc. If there is no such link and documentation includes both hypertension and heart failure, you would code the hypertension and heart failure separately. ICD-10 now combines coronary artery disease with angina into single codes specifying the type of coronary artery disease, or CAD, and the type of angina. If you're using a combo code, it is not necessary to use a separate code for angina or CAD. ICD-10 assumes a relationship between the CAD and angina. Therefore, as long as the two conditions are documented, a combo code is appropriate. Let's try a coronary artery disease example. We have a patient seen for evaluation of his continuing unstable angina. After significant evaluation, his symptoms were found to be due to atherosclerosis of his bypass graft. This is an autologous arterial graft. Final diagnosis: CAD of bypass graft with unstable angina and hypertensive diastolic congestive heart failure, acute on chronic. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is I-25.720, atherosclerosis of autologous coronary artery bypass grafts with unstable angina pectoris. As the final diagnosis is CAD of bypass graft with unstable angina, I started at disease in the alphabetic index, then found artery, then coronary indented below. Here there is a note which states, with angina pectoris, see arteriosclerosis coronary artery. If you need to use the CAD codes, I recommend tabbing off this section of the alphabetic index, as I, for one, don't automatically think of starting at arteriosclerosis for CAD. Once we follow these directions and are at coronary under arteriosclerosis, which for the Optum 2015 ICD-10 CM Expert for Physicians starts on page 26, we need to look for bypass graft. Under bypass graft, we need to find autologous artery, as documentation states that the bypass is an autologous arterial graft, meaning it's an artery from the patient's own body. Since documentation also states unstable angina, the word with is indented below autologous artery, followed by angina pectoris, and indented below this is the term unstable, which points to code I25.720, which you would then confirm in the tabular list. When you're coding for atherosclerosis in ICD-10, it is so important to pay attention to all the headings and indentations in the alphabetic index, as the codes are so specific in ICD-10. The next code is I11.0, hypertensive heart disease with heart failure. We know a combo code is appropriate, as documentation states hypertensive diastolic CHF. To locate this code, start at hypertension in the alphabetic index, and then find heart. Indented below heart is the word with, then heart failure with congestive in parentheses, which points to I11.0. When you confirm this code in the tabular, there is a note which states, use additional code to identify type of heart failure from category I50. Therefore, the third code would be I50.33, acute on chronic diastolic congestive heart failure, which can be found by either turning to category I50 in the tabular and locating the appropriate code, or the code can also be located in the alphabetic index by starting at failure and then locating heart. From there, you would look for diastolic, which has the word congestive in parentheses next to it as a non-essential modifier. Indented below this is acute, and then indented below acute is the phrase on chronic congestive, which points to code I50.33, which you would then confirm in the tabular. As in ICD-9, there are codes for late effects or sequela of cerebrovascular diseases. However, there are many more codes for this located in category I69 than there were in ICD-9, as ICD-10 specifies the type of cerebrovascular disease, such as non-traumatic subarachnoid hemorrhage and resulting neurological deficits, such as hemiplegia. One of the new features of ICD-10 is the concept of laterality. One way that laterality applies to this chapter is in hemiplegia and monoplegia. The ICD-10 codes for these conditions present with cerebrovascular disease include the side of the body affected, as well as whether it is the patient's dominant or non-dominant side. If the affected side is documented, but documentation does not state if it is the patient's dominant or non-dominant side, here is how you should code. If the left side is documented as being affected, but you don't know the patient's dominant side, the default for left side is non-dominant. If the right side is documented as being affected, but you don't know the patient's dominant side, the default is dominant. I think this all makes sense because most people are right-handed. Therefore, if the left side is affected, it's most likely the patient's non-dominant side. If documentation states that the patient is ambidextrous, your default code will always be dominant. Let's try a sequela example. Patient is seen in clinic to follow up from a previous stroke. He suffered a cerebrovascular infarction 6 months ago, which left him with aphasia and left-sided hemiparesis on his non-dominant side. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is I69.320, aphasia following cerebral infarction. This code can be located by starting at aphasia in the alphabetic index and then locating the term following. Indented below this is cerebrovascular disease and then cerebral infarction, which points to I69.320, which you would then confirm in the tabular. The second code is I69.354, hemiplegia and hemiparesis following cerebral infarction affecting left non-dominant side. This code can be located by starting at hemiplegia in the alphabetic index and then locate the term following. Indented below this is cerebrovascular disease and then cerebral infarction, which points to I69.35 with a checkbox indicating that more digits are needed. When you go to subcategory I69.35 in the tabular, you have options for right dominant and non-dominant and left dominant and non-dominant side. Since documentation states left-sided hemiplegia on the non-dominant side, I69.354 is appropriate. For this example, the sequencing of the codes does not matter. Either condition may be reported first. Also, you would not code for history of stroke as it's not a resolved condition since the patient is still experiencing late effects of the condition. Since the sequela codes are combo codes, we are able to report the stroke as part of the sequela code. There are many changes for myocardial infarctions in ICD-10. First of all, the time period for an acute MI has changed from 8 weeks to 4 weeks or less. The term subsequent also has a very different meaning in ICD-10. Whereas in ICD-9, this meant subsequent episode of care, in ICD-10, subsequent refers to an MI that has occurred within 4 weeks of a previous MI. So for example, if you had an MI on September 1st, and then another one 2 weeks later on September 15th, the September 15th MI would be coded as a subsequent MI from category I-22. A code from I-22 must be used in conjunction with a code from I-21, which is the acute MI codes. Category I-23 is for complications of an ST elevation MI or a STEMI, or a non-ST elevated MI, which is known as an NSTEMI. These codes must be used with a code from I-21 or I-22. Some additional information about MIs. If an NSTEMI evolves to a STEMI, this would be coded as a STEMI. However, if a STEMI converts to an NSTEMI due to thrombolytic therapy, it is still coded as a STEMI. If a patient is still receiving care related to an MI that occurred after the 4-week time frame for an acute MI, you're not going to use an I-21 code, but instead an aftercare code. Old or healed MIs can be coded as I-25.2. Let's try an MI example. This 54-year-old female is being treated for an acute non-ST anterior wall MI, which she suffered 5 days ago. She also has chronic atrial fibrillation. How would you code this? Please pause the webinar to complete this example, and then hit play to continue and learn the answer. The first code is I-21.4. Non-ST elevation NSTEMI myocardial infarction. This code can be located by starting at infarction in the alphabetic index and then locating the term myocardial. Indented below this is non-ST elevation NSTEMI, which points to I-21.4, which you would then confirm in the tabular. The second code is I-48.2, chronic atrial fibrillation. This code can be located by starting at fibrillation in the alphabetic index and then locating the term atrial. Indented below this is chronic, which points to I-48.2, which you would then confirm in the tabular. If you remember from ICD-9, there was a single code for AFib, but in ICD-10, there are now specific codes for AFib to capture the status, and they are chronic, paroxysmal, permanent, and persistent. Let's do another MI example. The same patient from the previous slide presented to the ED 2 weeks later and was diagnosed with an acute inferior wall MI. She is still being monitored for her initial heart attack 3 weeks earlier and continues to have AFib. She will be transferred to a larger facility for cardiac cath and possible further intervention. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is I-22.1, subsequent ST elevation, STEMI, myocardial infarction of inferior wall. This code can be located by starting at infarction in the alphabetic index and then locating the term myocardial. Indented below this is ST elevation and then inferior with wall in parentheses, followed by subsequent, which points to I-22.1, which you would then confirm in the tabular. Our next code is I-21.4, non-ST elevation myocardial infarction, which was our MI code from the previous example. Remember that the subsequent MI codes should be used with the code for the patient's MI that preceded the subsequent MI within the 4-week time period. And the last code is I-48.2, chronic atrial fibrillation, which we coded in the previous example. This code would go last because the reason for the encounter was the subsequent MI. Now let's do a hypertensive disease example. Patient has stage 3 chronic kidney disease with congestive heart failure due to hypertension. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is I-13.0, hypertensive heart and chronic kidney disease with heart failure and stage 1 through stage 4 chronic kidney disease or unspecified chronic kidney disease. We know a combo code is appropriate as documentation states that the patient's CHF is due to hypertension, which is required for using a hypertensive heart disease code. This code can be located by starting at hypertension in the alphabetic index and then find heart. Indented below heart is the word with, and then kidney disease. There is a note which states, see hypertension cardiorenal. Once you follow these directions and are at cardiorenal under hypertension, go to with heart failure, then indented below this is with stage 1 through stage 4 chronic kidney disease, which points to I-13.0. When you confirm this code in the tabular, there are 2 notes which state, use additional code to identify type of heart failure, which is category I-50, and use additional code to identify stage of chronic kidney disease N18.1 through N18.4 and N18.9. Therefore, the second code would be I-50.9 for heart failure unspecified, and this can be found by either turning to category I-50 in the tabular and locating the appropriate code, or this code can also be located in the alphabetic index by starting at failure and then locating heart. From there, you would find congestive, which points to I-50.9, which you would then confirm in the tabular. Therefore, our last code, N18.3, chronic kidney disease, stage 3, moderate, can also be found by either turning to category N18 in the tabular and locating the appropriate code based on the note, or this code can be found in the alphabetic index by starting at disease and then locating kidney. From there, you would want to find chronic and then stage 3 indented below, which points to N18.3, which you would then confirm in the tabular. Now we have a 67-year-old female being seen for treatment of angina with spasm. She has a history of 2-vessel coronary artery bypass graft. A recent cardiac cath shows continued evidence of coronary artery disease, but both of the bypass grafts are patent. Also of note, this patient suffered a cerebrovascular infarction 3 years ago, which resulted in right-sided hemiparesis. And just as an aside, patent means that the bypass grafts were open, so they weren't clogged. How would you code this scenario? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is I-25.111, atherosclerotic heart disease of native coronary artery with angina pectoris with documented spasm. If you remember from an earlier example with CAD, it is easier to start off at arteriosclerosis. However, if you looked up coronary artery disease by starting at disease in the alphabetic index and then found artery, and then coronary indented below, there is a note which states, with angina pectoris, see arteriosclerosis coronary artery. Remember, if you need to use the CAD codes, I recommend tabbing off this section of the alphabetic index, as I, for one, don't automatically think of starting at arteriosclerosis for CAD. Once we follow these directions and are at coronary under arteriosclerosis, which for the Optum 2015 ICD-10-CM Expert for Physicians starts on page 26, we need to look for native vessel, as documentation states that both bypass grafts are patent or open. Indented under native artery is the word with, followed by angina pectoris. Then indented below this is with documented spasm, which points to code I-25.111, which you would then confirm in the tabular list. When you're coding for atherosclerosis in ICD-10, it is so important to pay attention to all the headings and indentations in the alphabetic index, as the codes are so specific in ICD-10. The next code is I-69.351 for hemiplegia and hemiparesis following cerebral infarction affecting right dominant side. This code can be located by starting at hemiplegia in the alphabetic index and then locating the term following. Indented below this is cerebrovascular disease, and then cerebral infarction, which points to I-69.35, with a checkbox indicating that more digits are needed. When you go to subcategory I-69.35 in the tabular, there are options for right dominant and non-dominant, left dominant and non-dominant side. Since documentation states right-sided hemiplegia, but does not specify the patient's dominant side, ICD-10 says that for this scenario, since most people are right-handed, the default would be dominant. Therefore, I-69.351 for the hemiplegia affecting the right dominant side with the cerebral infarction is appropriate. We still need one more code, as documentation states that the patient has a history of 2-vessel coronary artery bypass graft. This codes to Z95.1, presence of aortocoronary bypass graft. To locate this code, you would start at presence in the alphabetic index, and then locate coronary artery graft or prosthesis indented below presence, and this points to Z95.1, which you would then confirm in the tabular. For our last example, documentation states atherosclerosis of the right ankle, native artery, with non-healing ulcer with breakdown of the skin. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is I-70.233, atherosclerosis of native arteries of right leg with ulceration of ankle. If you remember from the CAD example, with artery disease, it is easier to start off at arteriosclerosis. However, if you looked up atherosclerosis, which is what's documented, in the alphabetic index, there is a note which states, see also arteriosclerosis, which is necessary because there are no options for the extremities. After finding arteriosclerosis, we need to look for extremities, and then leg, which is located almost at the end of all the arteriosclerosis of the extremity codes. You need to pay close attention to make sure you're not still under bypass graft. Indented under leg is the word right, followed by with, and then indented below this is ulceration, then ankle, which points to code I70.233, which you would then confirm in the tabular list. When you confirm in the tabular, there is a note under subcategory I70.23, which states use additional code to identify severity of ulcer, category L97. Therefore, the second code is L97.311, non-pressure chronic ulcer of right ankle limited to breakdown of skin. If you didn't know we needed to be in category L97, which is what we were pointed to with our first code, and even if you did, I recommend looking up this code in the alphabetic index. To find this code, you would start at ulcer, and then find lower limb. Indented below this is ankle, and then indented below is right. Underneath right is the term with, and then the phrase skin breakdown only, which points to code L97.311, which you would then confirm in the tabular. At the beginning of category L97 is a note which states code first any associated underlying condition, such as atherosclerosis of the lower extremities. So that's a little pointer to us of which code needs to go first. And now it's time for our quiz. Our first question is, how is uncontrolled hypertension coded in ICD-10? Our second question is true or false. Category I-22 classifies acute myocardial infarction that occurs within 28 days of a previous MI. Our final question is, what category is assigned for sequela of cerebrovascular disease? You can pause the webinar to write down your answers and then hit play to find out if you were correct. The answer to our first question is I-10 for hypertension. Remember that ICD-10 simplified the number of hypertension codes and made a single code whether the hypertension is documented as being controlled or uncontrolled. The answer to the second question is true. Category I-22 is for subsequent MIs, meaning an MI that has occurred within 4 weeks of a previous MI. Our third answer is I-69. If you looked up sequela in the alphabetic index and find disease and then cerebrovascular indented below, all the conditions underneath start with I-69. Remember, the United States will begin using ICD-10 on October 1st of 2015. After the October 1st compliance date, it will be very important to verify that claims are being received and to check remits for denials based on the ICD-10 conversion. This concludes Chapter 9 of ICD-10-CM, Diseases of the Circulatory System. Please feel free to check out our webinars on all 21 chapters of ICD-10-CM. If you need further assistance with ICD-10 training for physicians and/or staff, please visit the VantagePoint website at www.vantagepointconsult.com or call us at 203-288-6860.